So today's cardinal lesson, we're talking about the Medicare insurance market, and we're talking about the disruption that's going on. And there's a lot of disruption. And my guess is that you, the consumer, you're right in the middle of something, you're not even aware of it. And so I want to push it to Tom, and I want Tom to share with you just exactly why we're doing this video today.
Yeah, I mean, we're doing this video because Medicare is going through a lot of changes that are starting, or they've sort of started now, but they're definitely picking up in 2026. And you need to know what those changes are because if you sleep through this, you're going to end up in a plan, or maybe the plan, keep the plan you have now. That will be the wrong choice, and you might be stuck there for a year. So you need to be aware of what's happening. We're going to walk through all the players that are involved in this, but at the end of the day, you need to make the best decision for you to make sure that you have the right plan moving forward. So let me bring up these show notes. You can find these at the link below our video. They're also on our website at cardinalguide.com. We have the board, and then in today's show notes, it's quite lengthy. We have the whole Medicare and U book for the 2026 version. Again, I don't recommend reading through all of it. You're going to walk away a lot more confused than you started. We'll try to help simplify it some on this video. We have other videos that sort of walk through the basics of Medicare. But I'll just take you to page 10. This is a lot of the information that's represented on the board. So we just pulled it off of here. We put it on the board. Again, if you want to have a snapshot of sort of a summary of how Medicare works, I think this is a good place to start. I don't recommend, again, reading the whole book, but if you want to, it's there. You can take a look at it. But I'm going to turn it back to Hans, and we're just going to walk through what are the changes and sort of why are they happening. Our goal of this video is not to make you like these changes, right? We can't make you like it, but we just want to objectively look at what are the changes, how can you best prepare for them, and make the best decision for you and your loved ones.
Okay, just want to bring up a little history. I started offering Medicare supplements in 1976 when I was 18 years old. And I've been in the industry ever since. This is my 50th year. And, you, the Medicare consumer, in fact, the turning 65 list, the list of people that we were calling on, and we just go to their house, they were born in 1911. So just kind of grab onto that dating. And so I've been in the business for 50 years. And the Medicare consumer, those people born in 1911 or before, they were there. The insurance agents were there offering the supplemental coverage. And the only thing that existed was Medicare Part A and Part B. There were drug companies, but they weren't part of the Medicare system. Medicare didn't even cover drugs then. They didn't start covering until 2005. The hospitals and doctors were there, and they just bill Medicare. You didn't have these large Medicare insurance companies. So it was a different time. And Medicare has evolved to where, like 25% of the country is on Medicare, or somewhere just short of 25% are on Medicare. The baby boomers are coming of age. This is a big deal. And the amount of money that's spent on this is huge. So you, the Medicare consumer and taxpayer, are right in the middle of a conflict and a disruption of the whole delivery system, and of which you're probably not aware of it, maybe at some level, and who all the players are. So I just want to set the stage. I don't want to give you all the details, but I'm going to tell you that in 2022, Congress passed the Inflation Reduction Act. So, and the Inflation Reduction Act had a provision where they had to give some benefits to the seniors. I mean, that's just anytime Congress does anything or passes a new law, they got to throw benefits at the seniors. And they were doing that when they put an overall cap, out of pocket cap of $2,000 on Medicare Part D. So if you have a Medicare, and it started, by the way, in 2025. So they passed the law in 2022, but the $2,000 out of pocket cap for you, the consumer, didn't start until the first day of 2025, which was earlier this year. So, what they did is they gave you a benefit, which is a big reduction for people that take a lot of medicines, and you're out of pocket, but they didn't put up any money for it. So I don't know whether they just thought that these insurance companies were just going to offer this catastrophic coverage, which is much more extensive, and where's the money going to come from? And so these people, the CMS, which stands for Center for Medicare Services, Center of Medicare Services, and the large Medicare insurance companies, they come to the table last summer in July of 2024, and these people say, okay, so this thing starts in 2025. We're going to have to offer these much more extensive benefits. We're going to need much more money from you, CMS, to pay us to offer these greater benefits. Or we're going to need to charge the consumer that has our Part D plan more money in premium. The money's got to come from somewhere, and it was a lot of money. They were asking different amounts for each one. And these people just kind of were shocked and saying, oh, we're not approving that. This was an election year in July of 2024. And they said, we're not going to have people getting bills or notices in the fall right before an election. So the government came up with some money to subsidize these extra benefits to the insurance companies just to kind of kick the can down the road. And they phased it in over 3 years. Well, now, upcoming, we're getting ready for the second year of the phase in. And this time in the summer or July of 2025, which was just a few months ago, these people met with these people and they came up with some kind of an agreement. And I'm thinking that that agreement is your Part D plan, your Medicare prescription drug plan, is going to cost you more by the month. I mean, that's the net result. So I want to kind of bring down the temperature of this whole thing a bit because, I'm saying it's a disruption. There's a lot of stuff. There's going to be stuff in the news. People are angry about things going up. The consumers are. The large insurance companies are saying, we don't make money on this stuff anymore. You're putting all these benefits that we have to provide and we don't have enough money. The government is passing all kinds of regulations that, especially on us, the insurance agents, is we can't make a move without a bunch of government regulations. We got to tape record the phone calls. We're enrolling you in the stuff. There's just a whole bunch of stuff going on that creates a very disruptive environment, and people are demonizing each other, and people in the press are doing that. The consumers are doing that, and they've got, so what we're doing today is just like Tom said, I'm just trying to explain the situation. I'm trying to bring the temperature down and just sit down and tell you like what's going on. Okay. So you've really got 5 players in this whole thing. You have the federal government and the Centers for Medicare Services, which is a division of Health and Human Services. You have the drug companies and the pharmacies. You have the hospitals and doctors. You have the large Medicare insurance companies. And then you have the insurance agents and these big call centers that didn't used to exist, but now there's like a football field of people in cubes and booths on telephone selling Medicare Advantage to people all over the country. And you've got these things that are very large. And I just want to make the distinguish between them and us. We are insurance agents. We work all over the country. We do most of it on the phone and Zoom. And we're not even really interested in this business just in and of itself. I mean, this is the way we got into financial planning with seniors, and we have 6,000 clients. So most of this video is being made for our clients. And then our viewers and listeners, people that don't do business with us, but they follow us every week and listen to all the financial planning videos and long-term care and all that kind of stuff. I just want to explain to you what in the world's going on. So when this stuff comes at you, you'll have a little frame of reference. That's why I'm doing what I'm doing. So what's gone on is we're sitting here and it's the first week in October. Medicare Advantage is annual enrollment period. Some people call it open enrollment. It's October 15th to December 7th. And that's the time frame when you can make changes in your Part C plan, which is Medicare Advantage, your Part D plan, which is drug coverage, and you really can't make changes in your Medicare other than you can disenroll from this or enroll in this. So it's about a 6 to 7 week period where you can make changes. Now, if your supplemental coverage, which most of our customers have this, you can change this 365 days a year. But your Part D coverage, there's a limited window of time. And then when December 7th passes with your Part D coverage, you're stuck. So a few weeks ago, I received this letter in the mail, as I'm guessing most of you did. Hopefully, you didn't throw it away. Hopefully, you read it a bit. But I'd suggest you go back, get it out. And this is the ANOC letter, the Annual Notice of Change. And I don't know, this thing's about 20 pages long. And it's about my Part D plan. And the very first page, actually, it's the fifth page, tells me that my premium's going up. And then it goes through the deductible is going up from 590 to 615, and just a whole bunch of pages and pages of changes that probably don't make a lot of sense to a lot of people. But the biggest thing that might be happening, that is happening probably, is an increase in premium in your standalone Part D coverage. Okay, you're going to have to pay more by the month, and possibly a lot more. So I'm just preparing you for that. The second thing that could happen, and they don't really outline that in this, is your formulary on your drug plan. So that's the list of drugs that are covered, could change. Okay, and they don't tell you in this, they just refer you to some list. And so what I'm going to do is I'm going to shift and I'm going to bring Tom back on. And what Tom is going to do is he's going to talk to you about opening up a Medicare.gov account if you already don't have one. Okay, if you don't have one already, many of you have them. I have one, and so he's going to take you into mine and show you. So, Tom.
Yeah, I mean, so I think like Hans mentioned, right, the biggest changes happening are around the drug plans, the Part D plans, and the Medicare Advantage plans, because most Medicare Advantage plans have drug coverage included with them. And it's really all around this increase of that cap, right, or limiting the out-of-pocket costs for the medications. And these insurance companies, that's more money out of their pockets. They got to make up the difference. So at the end of the day, they're cutting formularies, they're cutting benefits. We don't yet know exactly the changes they're making, but that's the expectation, and then the premiums are rising. And so you might find yourself with getting one of these letters like Hans has, where it talks about the price going up. You want to look to see, is this still the best plan for me? And it might be, right? It doesn't mean that you have to change every year, but it might be worth looking at. And so what I'm going to walk you through now is how you can actually do that online yourself. We can help with that, but again, I think sometimes it's easier to get on. You can play around with it yourself as opposed to just having to call us. So I'm going to take you to the website, Medicare.gov. And so you go to Medicare.gov, and there's this upper right-hand corner, there's a login button. Go ahead and click login. Now, if you've already created an account, hopefully you've saved your username, your password, you just log in. If you haven't created an account, hit the create account button, follow the prompts. You'll need your Medicare number on your Medicare card to do it. But if you haven't created an account, I would recommend you do that, because there's a lot of good information on here, regardless of the changes, that I think you should have it. So let me log in, and I'll show you around a little bit of how you can use this. But when you log in, you get this nice sort of screen. One of the things you'll notice is it walks through when your Medicare started, what drug plan you currently have, what your other coverage is, right? Do you have a supplement? Do you have an Advantage plan? It will all show up here. You can hit check my claims, right? So you can sort of track the claims that are going on for Part D medications or doctors and hospital visits. I think that's real helpful. A pay a premium option. So if you haven't started Social Security yet, Medicare, you still have to pay for Medicare Part B, and they will send you a quarterly bill in the mail. Sometimes it's easier just to go online and do that. They'll let you pay by credit card. They have the option to pay via an HSA if you have that. So there's a lot of options available online to pay the premium. Once you start Social Security, they just withhold that automatically. So that's really only for the people who haven't started Social Security yet. There's a Get My Medicare card, right? So if you lose it, you can go on there, get a digital copy, order a new one. All these are really good options. But what we're going to focus on here is you hit open all options. It takes you to a screen where I have a list of things that you can do. One of these options under plan and coverage is find health and drug plans. And so when you click on that, it takes you to a new screen, and it will go through. It will, if you're already on a drug plan, it will populate your current drug plan already, and so it has what Hans already has there. It goes through. It has a list of medications, right, that he's currently taking, and so if you're on medications that you have filled through your Part D plan, it will auto populate all that. You can go and edit my drug list, so you can add more medications if you need to. There's a lot of changes there. But at the end of the day, what you're going to do is scroll down and hit find plans now. Now, when we're shooting this video, it's not, they haven't released the 2026 plans yet. So we're not going to look in this video at what the 2026 plans are. But once they do release those plans, which is October 1st, that's when you'd actually see the upcoming year plans. But you'll put in your zip code, you pick the county that you're in, hit go, you select the plans we're looking at. So right now we're going to look at Part D plans. That's what Hans has. He has a Medicare supplement and a Part D, a drug plan. So you hit find plans, it will go through, and it will, at one point it let me pick the pharmacies too. So you can change the different things. You can change pharmacies. You can look at different options there. And like you can the view. So sorry, I'll just take a look at the pharmacies that I picked there. But at the end of the day, what it will do is pull up the plans and order them. WellCare, at least for 2025, had a zero premium plan, which was in North Carolina. At least your state might be slightly different. You can look at the cost of the medications, and you can compare the plans side by side. So I'm not going to do that right now, but it's a very good information. It will have all the plans available. You can filter it by different things, and I think it's a very useful way to compare the plans leading up to it. And if you haven't ever compared your drug plan to other options, this would be very worthwhile doing. And you might be able to save a little bit of money, especially as these plans are going through changes for 2026 with increasing premiums, changing of formularies. You might be on a plan that covers a certain medication and they might not for next year, right? So that might require you switching plans. I think it's a very useful tool. Even if you don't do this part of it, I certainly would recommend creating an account on Medicare.gov so you can see all that information. At the end of the day, if you have questions, you can call us. We can help walk you through this as well. But sometimes it's just easier to go on and take a look at yourself.
Yeah, I just want to make the point. We're not dodging our role here. Is if you bought this stuff from us and now you're confused and you want to compare your drug plan and you want to send us your list of drugs, that would be helpful in advance. And you want to call in or write in and say, listen, I want you guys to do this for me, we will. Okay. And we're just showing you how you can do it yourself. And it's pretty efficient. It's pretty easy. So I wouldn't even have to, as I go in and shop, I'm going to go on this thing and it already knows all the drugs I'm taking. And so I can compare it against all other plans. And that's the thing that concerns me the most is not the premium for the Part D. I just want to make sure that the stuff I'm taking is going to be covered by my plan next year. And if it's not, it'll show that in the comparison. So enough with that. If you want to call us, get in touch with us. We'll do this for you and with you. Okay. And we have a separate program that we go into that'll just do the same comparison. But we need to know what your drugs are. Okay. So what I want to do is give you just kind of a quick overview of Medicare, original Medicare, and then Medicare Advantage, because I think this will be helpful for most people listening to this to just go through it for those of you with review. So original Medicare, which is what they had when I started selling this in 1976, you had Part A, which is the hospital, Part B, which is the medical and outpatient. And back then, when you got sick, you went in the hospital and you had surgery or whatever. And so, half your claim was under Part A, maybe more than half the claim was under Part A, and then just some of it was the doctors and outpatient. Now it's rare that you go into the hospital. You're really sick when you go into the hospital. You go in as an outpatient and have surgery, and that all falls under Medicare Part B. So original Medicare over the years has the deductibles have grown. The Part A deductible for next year is up over $1,800. Nobody knows what it is exactly because most people have supplements that just pay that. So, but Part A of hospital has big deductibles, and then Part B has an annual deductible, which is smallish. It's like $200 and some dollars, like $256, something like that. So that means if you're a doctor and outpatient, you pay the first $256 yourself, and then Medicare Part B pays 80% of approved charges after that. You would be paying 20% if you didn't have a supplement. Okay. And so if you're on original Medicare, this is where you are, and you're paying $185 a month for Part B, unless you fall under IRMA. And IRMA is income related monthly adjustment amount. We have several other videos talking about that. We don't have the 2026 numbers for IRMA, but as soon as we do, as soon as they're out, we're going to make a video on that. But many people that have a high income in retirement are paying $500-600 a month for Medicare. That isn't part of this disruption. I mean, it's just just whatever the amounts are, they are. But there's not any drastic changes that I foresee coming the next year. But the important thing to understand is you're either here or you're here. You can't be both places. And from October 15th to December 7th, if you're here, you can make some moves to get over here. And if you're already here now, you're on a Medicare Advantage plan, and you want to go back to original Medicare, you can do that October 15th to December 7th. And when you would make that, before I would do that, I would apply for supplemental coverage first. You can do that through us and make sure that gets issued. Because if you got serious health conditions, you're not going to be able to get a supplemental coverage. You may be stuck here. So you want to get that taken care of first, and then we can help you with that. We can get you from here back to here. Okay. So important to understand that you can't be both sides of the board. Now, if you're over on this side and on original, what I really want to hit is why would you want to be here and why would you want to be here? The main reason to stay on original Medicare and buy a supplement, the main positive is you're not under managed care. You don't have networks. You don't have pre-approvals for surgeries. You're just covered under Medicare. The doctor is regulated by Medicare, and so the doctors don't have to ask somebody at Medicare, can they do whatever they're going to do? And you also don't have to look up the doctor to see if he or she's in network. There are no networks under this. There's just people that take Medicare and people that don't. So that's the positive, is you can go to any doctor anywhere in the country that you want to go to. Like, the Mayo Clinic, I know for a fact, doesn't take these things. So if you were going to go to with some serious illness to a research hospital, that would be an advantage of staying on original Medicare. Or you're on vacation, or you spend part of the year in Florida and the rest of the year back at home. You would maybe want to stay here so you don't have to worry about where your doctors are, whether they're in network. Okay, the negative to staying over here is you got to pay a premium for the supplemental coverage. So, I mean, that's $100 to $200 a month. And I'll go back to the positives. Between the original Medicare and the supplements, you're going to have less out of pocket than you will over at the Medicare Advantage side. So that's another positive for there. So why would you want to be over here? Why does, more than half of the people that are on Medicare have Medicare Advantage plans? Okay, and I'm going to tell you is a lot of these Medicare Advantage plans have been zero premium. So the Medicare Advantage, the large insurance company, they get a check every month from the federal government, from CMS, to deliver Medicare to you. Okay, so what they're after is you have, by your election, chosen to leave original Medicare and go into this Medicare Advantage plan. They're going to get a check every month. And so all of what they're going to provide for you, you're not going to have to pay the premium for this in a lot of cases. Now that may be changing. So because of all this stuff, this disruption that's going on, you may have already gotten a letter in the mail that your premium was zero and now it's going to be X amount. So that could propel you or make you decide you want to shop and make sure you have the right Medicare Advantage plan. Or you might be at a point where, look, if I got to pay a premium for this, I want to go back here. We can help you with all of that. So this is not an ad for Medicare coverage. This is an explanation and really kind of setting what's going on for you. But we're in the consulting business and we're licensed in all 50 states in DC. So the Medicare Advantage plans, so there's a private insurance company alternative. It's managed care. So some folks are going to look upon that as a negative. So their job is to manage your care, is to suggest alternatives, to direct you to certain doctors, to get pre-approval in some cases from the plan before they do the surgery or the procedure. It's smaller copays. They have to be than that. So that's a plus. It's often zero premium. I already went over that. You still pay the $185 a month, even though it's said to be zero premium. You still have to pay for Part B of Medicare. And then many times, well, it includes a gym membership, it includes dental, vision. So those are called ancillary benefits. So there's a lot of reasons to be over here. And it's not that serious what you got to put up with. A lot of people are very happy with this, and they have to go to certain doctors. They've checked to make sure their doctors are in the network. This system works just fine for them. They get these extra benefits. They don't pay anything for it. And then typically, most of them are going to include a Part D drug premium, still included in that zero premium. But here's where the problem comes in, is these Medicare Advantage companies that are offering Part D, they're facing the same problem as the standalone Part D plans, is they now have to pay all your drug costs after you've had an out-of-pocket of $2,100. Um, so we don't know exactly what they're going to do, but we have it in our computer and we just received it. So, we can go in and tell you all this stuff on a comparative basis through a computer program that we have. You also can go on Medicare.gov, open up an account, and you can go in, enter your drugs, just like he showed you, or they're already in there if you're on a Medicare Advantage plan, and then compare your Medicare Advantage plan against all other Medicare Advantage plans. And even go ahead and enroll in a new one if you wanted to. We'll be more than happy to help you with that. But again, I want to point you to the website first, because a lot of folks these days are not scared of websites and they like doing things on their own. So that's this side. But what I want to stress is you can't be both places. You're either here with a supplement and then with a drug plan. So to that extent, you can buy a standalone Part D drug plan, or you're on this side, but you can't be both places. So, Tom, I know I spit out a lot. What do you have to add to that?
So what we see a lot of times is people don't know where they're at, right? They have original Medicare and a Medicare supplement, but they're telling me benefits and features of Medicare Advantage plans or vice versa. And so the first step to figuring out what you need to do, if anything, is determining where you are. Are you on the left side of this board or are you on the right side of this board? The easy way to do that is get your card, your insurance card. So not the Medicare card, but the one that the insurance company sent you. If it's a supplement, it will have some letter plan listed on there. Plan G, Plan N, Plan F. That is a supplement. You're over on the left side. If your card says something like HMO or PPO or something like that, that's Medicare Advantage plan. You're on the right side. So first step, identify where you are. And then once you know that, now you can determine what makes the most sense, right? If you're on a Medicare Advantage plan, your plan is likely going through some changes for this upcoming year for 2026 that might be increasing the premium and might be cutting ancillary benefits, right? Maybe they reduced the dental benefits or vision benefits, or we just don't know yet. But expect some changes there. If you're on original Medicare and a supplement and you have a standalone drug plan, what I would expect to see there is an increase in the premium for the drug plan specifically, and as well as maybe a shrinking of the formulary. So if you're on really generic medications, the formulary part probably doesn't impact you. Still check, right? We don't know, but it probably is not going to be as big of an impact. But if you're on some pretty expensive medications, very likely could impact you, and that might steer you towards a different plan than what you currently have. So those would be the two groups of people. Identify where you are, think about what changes might be happening, and at the end of the day, go onto your Medicare account, compare what you have to what's available, and make sure it's still the best option for you.
So what I want to do is just get back to the conflict or the disruption, and just, what I want to do is just take down the energy level. Is none of these five entities are demons. They're just not. The government's not a demon. The legislature, the Centers for Medicare Services, they're not demons. The drug companies are not demons. Um, I mean, they may appear like that, but they've invented a lot of drugs that we really, if they took them all away, we would be very upset. And there would be a lot of people that their lives would be shorter. And I'm sure they have everybody's got a bit of blame in this whole thing. So I'm not saying that these people are without blame. I'm just saying that demonizing organizations or institutions or the people in them is really not helpful to understanding the conflict. Hospitals and doctors, same thing, especially the financial people. I mean, they got to run a business, even though it's a nonprofit business in a lot of cases. Well, the doctors aren't nonprofit, but the hospitals a lot of times are, and it's a business. The large Medicare insurance companies, the United Healthcare, the Humana, the Aetna, the Cigna, the Blue Cross, they offer Medicare Advantage plans. They pretty much, who I just named, dominate that market. They also offer these Plan G supplements too. So, and a lot of people are confused over which one they're on, but these people are not saints, but they're not demons either. They serve a very good purpose without them. We're glad we have them. And then the insurance agents and call centers, I guess some people are going to call us demons, but everybody's got a hand in this, and everybody has a hand in the solution. And I'm just wanting to prepare you. The worst this is going to be is perhaps your Medicare Advantage plan is all of a sudden going to start asking you for a premium when it's been zero. Some of them have been giving you a credit back toward this $185 a month. Maybe that's going to be cut back or gone away. Some of them are going to again start charging you a premium because the Part D, which has been part of zero, they've got an increased cost. So we're back to charging you a premium. Some of them, these extra benefits like dental, gym, vision, that may be on the table. And maybe not this year, but another year. Is some way or another, they've got to figure out this mix to keep offering this, but yet do it at a profit. And so, or they're going to have to get out of it. And so this year, you're going to see these changes incrementally, and they're probably not going to do a very good job of explaining to you why all this is happening. That's what I'm attempting to do here. As far as the original Medicare, I don't really foresee any drastic changes in Medicare itself this year. I mean, sure, this is going to go up the 185. They're going to tell us in the end of November, the deductibles and co-payments, but nothing out of the ordinary that I foresee. The supplemental coverages, sometimes people think that that's swooped into all of this. And I will tell you that during the pandemic, 2020, 2021, claims on Medicare supplements were down. People were not seeking out care. They weren't having surgery. And maybe they weren't down, they just leveled off or whatever. The insurance companies had lower loss ratios during that time, but then there was inflation going on and there was a flip. So then 22, 23, 24, those claims have been back on the rise. So look for this to go up, but it's not going to happen in October and November. You're not going to be notified of it, most likely, unless that's coincidental. So overall, these things are going up. just expect to pay more for that. And that's about the worst that it's going to be. But the communication around this, it gets really charged. So I want to bring Tom back on for some final thoughts if you've got something to add to the whole thing.
Yeah, I mean, I think that, anytime there's changes, people are going to get upset just because, most people don't like changes. Our goal here is to not, our hope for you is to not get upset, but just understand a little bit more why it's happening. All the changes are not bad, right? I mean, let's look at the bright side of this. Seniors who are on really expensive medications, now that's capped for 2026 at $2,100, right? So people who had these really large out of pocket costs, this will benefit them greatly. So there's some benefit, there's some nice things in all of this, right? So it's not like it's evil, it's not either good or bad, it just is, right? There was a law that was passed, and now that's what we're dealing with. So we just want you to know what's happening, why it's happening. Don't get upset about it, or I can't tell you what to do, but try not to get upset about it. And let's just look to see, how do we make this the best it can? What decisions can I make now that will put us in the best spot moving forward? And that's really the goal here. And so, if you, again, you can go on the website, take a look. You can call us, we can help you review them. Clearly we know how all of these work. If you just like, man, I don't know any of this, I just want you to help, give us a call. That's what we're here for.
So, how does this fit in the context of retirement planning and all the 7 subjects, the 7 worries that we work in? I mean, we spent most of today talking about Medicare, and Medicare, you get it at Social Security. So I guess we're going to check those 2 boxes. We haven't talked about long-term care. We haven't talked about 401k and IRAs. We haven't talked about your income, other than you're going to need to use some of it to pay increased costs. We haven't talked about estate planning or taxes. So it's really been all about Medicare today. And in our business model is that Medicare consulting brings people, consumers, brings you right through our front door via Zoom. And we're giving you the Medicare consulting and providing that to you. And it also, people discover that there's opportunities to get the whole package put together and get advice on all 7 subjects. So I want to bring Tom back on. I'm Hans Scheil.
And I'm Tom Griffith.
And we thank you very much for listening.
Thank you.